Hello and welcome to another episode of the Edmonds Mom's Room podcast. I am Dr. Allison Feldt, your host, mom of three, entrepreneur, owner of Body Motion Physical Therapy, and lover of life. So I am just happy to be here with you today. We are talking all things abdominal scar tissue. So this episode is going to be amazing. If you've ever had an abdominal surgery, even when you were a young kid, if you had a bladder surgery, if you had an appendectomy, so you had your appendix removed, if you've had a gallbladder surgery, this is really important information for anyone who's had a surgery abdominally. And even if it's just portholes and or you've had a C-section, we are going over everything that happens when you have abdominal scar tissue. There are a lot of risks of having abdominal scar tissue that no one really talks about. So I have a whole chapter in my book about what happens to your body after C-sections and how your C-section scar 10 years, 15 years down the line can actually cause you long-term hip pain. And the reason that chapter is named what it is because abdominal scar tissue deeply affects the core. The core is made up of muscles on the front of your abdomen, on the back side of your body, your glutes, your low back muscles, your pelvic floor, and your diaphragm. When you are cut into on the front of your body in your transverse abdominis muscle and or in any of the core muscles, what happens is there is left behind scar tissue. This is especially true with a hysterectomy, with a tubal ligation, with a C-section, and whenever we have increased scar tissue, it impacts the ability of those muscles and that core to work effectively. So one thing that's a really imperative is that after you have an abdominal surgery, you need to work with a pelvic expert physical therapist who can really manipulate the scars and help you dissolve the scars. We also use a regenerative technology in our clinic called radial pressure shockwave technology, and it is a tissue regeneration tool. So it helps dissolve the scar tissue, allowing the tissue to lay down new healthy cells to create collagen, elastin, which creates new structure of the tissue. And scar tissue itself isn't contractile and it doesn't relax very well. So you have to get scar tissue mobile and hopefully get it to dissolve as much as you can. One thing that people don't realize is like C-sections. They're just such a common surgery. And what happens after C-sections is that you're stitched up and you're told to go home, recover, you're gonna be good to go in 6 to 8 weeks. And most people don't feel that way. Most people feel like not only am I a bag of bones from being stretched out for 10 months and then having to recoil and be stitched up, but now I don't know how to use my core. I don't have a lot of function. So you might go to a class, a postnatal class or a postpartum class and get some core exercises. But the reality is, even if you're doing all the core exercises in the world, if you don't work out that scar tissue, the scar tissue within the abdominal wall is not going to contract and relax. So you become weaker. Not only that is that the scars can become numb, they can become they can become painful. The other thing that abdominal scar tissue creates is more tension. So scar tissue in our body, if you're watching this on YouTube, what you'll see is the scar tissue on our body becomes like crossed fingers, and it's like a really good mechanism for healing because then it won't re-rupture. But over time, scar tissue can migrate around different organs. So what happens is sometimes people in their 60s and 70s will have bowel obstructions from scar tissue that's migrated from an old C-section scar. And that's a very real consequence of what can happen after an abdominal surgery. So it's just something to keep in mind and why this healing is so important. When we don't have optimal core function and you don't have good core support due to having an abdominal surgery, what ends up happening is you'll have hip pain, back pain, chronic sciatica, or you'll have SI joint pain. Maybe you'll have foot pain or knee pain, which will then transfer to the opposite side of the body in the hip and or in the SI joint, and it creates dysfunction and it creates arthritis. And so what's really important is making sure the core turns back on after any abdominal surgery and then dissolving that scar so the core can function. Specifically, what happens when that scar tissue hardens even further is it will pull up on the bottom of the core, it'll pull up on the sides of the core, creating increased tension, which you might be like, yes, that's great. I want to have a snatched waist or I want to be tighter, but we don't want that. We need elasticity. We need movement. That's the strength comes from the movement of the tissue. The other thing that it does is any abdominal surgery is going to pull up on the pelvic floor, creating more tension of the pelvic floor. This definitely doesn't mean you get a vagina lift. This absolutely means that you get more tension in the pelvic floor. This can cause things like inability to climax. This can cause things like urinary incontinence. This can cause things like painful intercourse. This can cause things like excruciating menstrual cramp or heavy excessive bleeding. And so what we will often see is that women about 5, 10, sometimes 15 years post C-section, depending on when they go through menopause, will have these scars that go through their uterus. And when the tissue is so hardened from that scar tissue, and the scars go all the way down to the uterus when you have a C-section. They go 7 layers deep into the body, including in the uterus itself. And when there are scars through the uterus, what we hypothesize happens is that when those scars harden over time and that tissue becomes so tight, when the uterus has to slough the uterine lining once a month during menstruation, the uterus has to work so hard to contract against a lot of resistance around the uterus, against the resistance of the scar tissue in the uterus. And so it takes a lot of effort, which creates more pain, which is also perceived as like I have more menstrual cramps. So helping dissolve that scar tissue 100% helps decrease excessive bleeding and helps decrease menstrual cramping. So getting the movement of the tissue is really, really important. I originally brought in this tool called radial pressure shockwave into my practice. So essentially it's called extracorporeal shockwave technology. It's kind of irrelevant what it's called. It's these sound waves that go into the tissue. They create these little micro traumas and they break the scar tissue up, allowing there to be this new healing process where the collagen and elastin make new cells. And it's literally tissue regeneration at its finest. It is beautiful. The effects of one treatment can last up to 90 days. Like you'll still see cellular changes over 90 days, which is just absolutely incredible to me. And so I brought in this technology. It's used in the aesthetic space for like core tightening. It's used for cellulite, body shaping, and that kind of thing. Which is cool, but I'm all about the function and like thriving through midlife. So I'm going to invest in anything that's going to help improve my core function. And of course I like to invest in things that make me look better too. But really when we're talking about like full body healing, especially after babies, we want to do everything in our power to make the core strong, not necessarily just look good, right? Like you can have a strong core at truly any size. And so for me, I brought in this radial pressure shockwave because of its impact on what I thought it could do for scars. And it wasn't being used in the space for dissolving C-section scars, but I thought this is exactly what we need. The reality is like no matter how much we manipulate a lot of the C-section scars, which they absolutely need to be manipulated and moved because those scars need to stay mobile over time. So you don't become the 70-year-old lady with a bowel obstruction. You have to get those scars moving and staying mobile. And when we get those scars staying mobile, I always felt like we did a great job with that, but there was just a missing piece. And so I decided to bring in the radial pressure shockwave technology, and I did it a little selfishly too. My daughter was doing a lot of gymnastics at the time, and I thought, well, this will be great for all her little tendinitises that pop up because it's used a lot in the orthopedic space. So like for shoulder pain, for plantar fasciitis, for knee pain, for you name it, different tendinitises. And that's great for me treating my own sports injuries and treating my kids' sports injuries. But then also I had this inkling that like, this is what we need to fully dissolve these C-section scars. I called my friend, his name is Kevin Vandy. He owns a practice down in San Jose, and he had gotten this technology in his clinic. And I was like, can you please just try this on your wife's C-section scar and let me know the results? Like, how does it go? After one session, he's like, my wife can actually feel her scar again. He's like, and I think she's activating her TA better, her transverse abdominis muscle. And I was like, okay, like I'm sold. So got the machine. He did more treatments on his wife. His wife is completely pain-free. She always had like some residual ache in her scar and just it never felt right. And I think she had back pain too. I can't recall exactly. I should get him on here to like verify. But anyways, it's regardless, like the results were absolutely epic. And so that's what we brought it in for. We started seeing like these C-section scars melt. We started seeing people's low back pain go away just from simply doing radial pressure shockwave and melting the scars on the abdomen. And I always knew, like you can read in the postpartum book that I've written, Restore Your Body After Kids, you can read all about how abdominal scar tissue vastly affects the core function, vastly affects your pelvis, vastly affects all the joints of your body. And so we have to get rid of scar tissue in order to truly allow the core to function well. Even if you've had a tummy tuck or liposuction, you want to get those scars reduced as much as possible in order to help that core function and become stronger. One of the things that is completely like kind of neglected even is like endometriosis. When they go in and resect endometriosis, you still lay down more scar tissue just from that surgery alone. So removing the endo adhesions or removing scar tissue actually creates more scar tissue. And so we want to do things as least invasive as possible. And so that's where this technology really came into play, and it has been amazing. So before I was recording this episode, Devin, our general manager, she told me, she was like, yeah, we did it on my sister just one time, and she was hospitalized for how bad her menstrual cramps were for like 3 months in a row. They couldn't find anything wrong with her, and she's like, it's just like excruciating menstrual pain. Comes in, and she had a previous appendectomy, and then she had another abdominal surgery. I think she had a cyst removal. And so she comes in, one session of shockwave. Next month, no period cramps. Month after that, no period cramps. Month after that, no period cramps. Like, and we're talking hospital bills that are now gone, right? Because she did one session of dissolving her scars. And the glory of this is not just like the one session, right? It's what you're doing for yourself in 10 to 15 years. Now, granted, we don't know the cellular, like we're not doing like a preoperative and post-operative exploratory study of, oh, how is this scar tissue actually changing? But we can feel with our hands that it absolutely melts to butter and just completely dissolves, especially if you have like a muffin top over the scar, or if your scar is deep, or you're getting kind of that shelf, the C-section shelf over the scar. You can dissolve that. Like, you can really melt that tissue to get it to normalize and become one. And when we do that, then we get much better core strength and core tightening, really. So I personally have been using shockwave since I've lost 100 pounds. I've been using it for my core tightening and really just to help firm my skin up. And there's just so many effects. And since I've been doing that, I really haven't had any period cramps, which is what I used to have quite significantly. So when we started doing shockwave for the abdominal surgeries, what we started seeing is that like all these people had these benefits of, like, even if they didn't have scars, okay? So no scars on the abdominal wall. We started to see when we do it to postpartum people just to help their cores heal, they all of a sudden had no menstrual pain. Their pelvic floor tone was much better. So meaning that it wasn't super tight and it wasn't super loose. Things just felt normal, which is amazing because then they get better core function, better core strength. And so their cores are much stronger. So it's just a really cool, it's amazing what it's done. We've noticed that how it changes orgasms. So if you have difficulty orgasming, or you have to work really hard for your orgasm, it is amazing at helping healing that and really allowing the tissue to fully contract and fully relax. And so it's been amazing to help people like hit that climax. It's been great for perineal scars. So we use it for scars that happen during childbirth. Of course, we pair all of this with our manual pelvic floor expert care. So people are getting a combination of both, but this tissue regeneration is amazing. But back to the abdominal scars. So not only that is we are seeing it help with libido, we're seeing it help with, I already said with orgasms, but it's just been a really cool technology to see how it is changing and affecting the core. But the take-home message of this episode, even though it's a quick one, is truly, if you have abdominal scar tissue, you have to get that abdominal scar tissue worked out. It doesn't matter if it's from a hysterectomy, from a tubal ligation, from a cesarean section, from a laparoscopic surgery to remove a cyst, a fibroid, or anything of the like, a gallbladder, an appendix. You just need to get that scar tissue worked out so you can have better contraction of the core itself. And when we have better core contraction and core function, our joints work better, we have more energy, we feel better, we feel stronger, and we can go for a lot longer throughout the day. And we know that our exercises that we're doing are supporting us and not hurting us. So there is nothing worse than seeing someone in their like 50s and they're like, yeah, I've been working out my whole life. And I'm like, well, your core hasn't been working out with you. And so therefore you've just put a ton of strain on your joints. And when that starts to happen, you know, that's where we start to see like the chronic sciaticas, we start to see that chronic SI joint pain. That's where we start to get knee arthritis or the hip arthritis. And that's just a problem. And it doesn't need to be that way. And so if we start really normalizing, okay, if you have an abdominal surgery, you know, hopefully you don't, but if you have an abdominal surgery, you have to get that scar tissue worked out so your core can function again. And if nothing else, know that the result of abdominal surgery, one of the risks, not the result, but one of the risks that happens are bowel obstructions because scar tissue migrates. You have to get your scar tissue worked out of your abdominal wall to at least avoid scar tissue migration, bowel obstruction, and truly get the core functioning on all layers and planes. So people always say like, okay, for a C-section scar, if you have the scar, you want to be able to pick the tissue up, you want to be able to move it up and down, you want to move it side to side. But if the tissue can't, you know, come up off the tissue below it, then you have more scar tissue. But the deal is, when you scar down after any type of abdominal surgery, especially a C-section, that scar is just the superficial layer. The scars below tend to be on different planes. So you might see the scar here, but majority of the scar tissue might be sitting up higher, or the scar tissue in the uterus might be even, you know, above the scar line, or you might have some scar tissue below that's migrated. Because when they stitch you up, you're usually more extended than when you start to shrink back together, and the scar tissue is going to shrink back on different planes. So the scar you see is just the very superficial visual scar. The scars that tend to affect the core the most, that affect the bowels the most, that affect the constipation the most, that affect the sex the most, are the scars that are deep. Those are the non-visible scars that you can't necessarily see, but someone with a trained hand can absolutely feel. Also, using the radial pressure shockwave is also very diagnostic because it will take us and we can trace scar tissue with the actual tool itself. So it's just a really cool phenomenon, and I just want to use this platform to help get the word out there that if you have or are going to have abdominal surgery, it's absolutely imperative that no matter how strong you are going into that surgery, that you get your scars worked out after your surgery and retrain your core and your pelvic floor, because they are very much connected fascially by and through all the organs themselves. And so it's just really, it's an important thing to keep in mind. It's not normalized in our society, but it absolutely should be. And if you have any questions, please comment below on our YouTube channel, and I am happy to answer them and get you any information specific to you. No one should have to live with abdominal scar tissue. And if you are, like, it is gonna have some impact on your life. So I want you to make sure that you can get it completely dissolved, completely functional, so your core can work for you. I hope you found this information valuable. Thank you so much for being here. Please like and subscribe to our YouTube. Like us on Spotify, leave us a review, whatever you gotta do. Just let's help get the word out to as many women as possible. Let's get them the most optimal healing so we can all be empowered, powerful souls. I'm Dr. Allison Feldt. Thank you so much for being here. Take care.